Right, I'd now like to move on to Bruce Adams, Commercial Director of Spirit Health. He's going to be talking about remote patient monitoring in international health systems, exporting best practice and importing it back to the UK. So we've heard a lot about remote monitoring this morning, and we can hear a little bit more before lunch. Thank you.
Thank you, Niall, and thank you for chairing this. Just before I get started, I have seen and witnessed the Healthy IO product and service in practice, and it's fantastic. So I would really, really thoroughly recommend going and looking at those guys.
It is available outside of it.
So I'm Bruce Adams. I'm the commercial director at Spirit Health, who are the ultimate owners of a platform called CliniTouch. Thank you to the GovConnect team for having us here today, and for all the speakers who've come before for all their insights. It's really quite inspirational to look at the vision that we have for our health systems. Spirit Health as a company, we're incredibly varied. We've been around for well over a decade. We are one of the largest diabetes education providers in the UK. We deliver pulmonary rehab services. We deliver primary care services to around 60,000 patients across the Midlands, and we deliver also medicines optimization services at scale across the UK, across the NHS. But really, what I'm here to talk to you about today is our digital health platform, which is called CliniTouch. We've heard a great deal about remote patient monitoring today, so I don't think I'm preaching to the converted about what this type of technology does. But essentially, it connects the patient at home with the clinician in a hospital or in a service. Now, we have deployed this at scale in the UK's NHS across patient populations in the millions and over around about 25 different clinical pathways over the years. And we know the NHS incredibly well. A lot of us are NHS background or NHS and care background, and we understand its challenges. So we made quite a brave decision at the start of 2022 as an organisation that we know our system, we know it incredibly well. We've got these huge big projects that we've worked on over the years, and we felt the time was right to take this into international markets and to go out and support organisations who were like Spirit, were a good culture fit, had passion for pushing healthcare forward, especially in the digital space, and that we could mentor and coach to achieve the same. Why did we do that? Because we don't know international care systems like we know the NHS, and equally part of our culture and our vision is to provide the tools and the technology and the expertise for countries, especially in developing nations, to drive their healthcare systems forward at a pace that can be achieved in this day and age. So over the course of the last 18 months, we've been working a great deal internationally with our in-country partners, and we've learned a great deal about the unique challenges, but also the opportunities that exist for this type of technology internationally, and we're equally learning a great deal and bringing that back into our projects that we deliver in the UK. So to give you an idea of the types of markets that we're operating in now and designing projects in, so we've got projects being designed in India, across Australia and New Zealand, over in Canada, over on the European continent, and a great deal in Africa currently, as well as we look to support organisations and engage organisations to make a difference locally. So what are we starting to learn? So as we design and work with local partners and local health systems internationally, we start to see these differences and these different challenges. What's really interesting is the private insurance systems that operate in many different countries, and their absolute desire and slightly different nuanced driver of keeping patients much healthier at a much early stage. and also with the overall obvious goal of stemming demand. So if you look at the UK market for digital healthcare over the past 18 months, 2 years, it's very much been focused on virtual wards. And don't get me wrong, virtual wards is hugely important and is part of the complete puzzle, but is still a reactive approach to healthcare. It's about increasing capacity for the system to treat people when they're unwell. What we see internationally, and we increasingly want to push forward in the UK market, is this more proactive caseload management of people with long-term conditions, with the absolute goal of reducing demand on primary and secondary care services, but equally in providing patient outcomes where the patient feels genuinely more connected to their health system. So we know about the challenges in primary care currently, the 8 a.m. dash for the phone call. We're starting to gather evidence now where if you have patients with long-term conditions who are connected through digital solutions, then they don't feel the need, they feel connected already, they don't feel the need to get on the phone to primary care quite as much as they do. Equally, with where patients are connected through digital solutions, and you'll find multiple around, they have access to the longitudinal health data and condition-specific education that can genuinely provide a greater likelihood of self-care for conditions. What's interesting in the private insurance market is that they are obsessed with reducing hospitalisation, slightly different to the drivers necessarily within the NHS, but they are about cutting cost. The cost of someone hospitalising to the private insurers is huge, but equally they are incredibly customer focused. So the goal of, let's say we're doing some projects down in South Africa, the goals of private insurers are to keep that customer loyal to that insurer. So how are they achieving that? They're achieving that through enrolling people onto digital healthcare solutions in a bid to keep them loyal to that system. However, what we're seeing is that by being enrolled onto that system, you get greater patient outcomes because we're intervening earlier. People aren't tripping over into hospital. People have access to all this data, and I think there's a lot to be learned from population level earlier intervention, long-term condition management, rather than the shorter-term focus that I think potentially, this might be slightly controversial, but we are a bit controversial as a company sometimes, the focus on virtual wards and that short-stay virtual ward stay. We see all the evidence that we've collected over the last decade or so points to the main benefits of this type of technology being in long-term condition management, and that's what we're seeing the interest in internationally. Something else, and again, it might be a little bit of a soapbox moment, but keep the technology simple. I think as an organisation, we, again, have been doing this a great number of years. We've equally had all this international learning over the last few months, and we get increasingly concerned about the high-tech level of digital and remote patient monitoring, if we're thinking about the patient cohorts that we are looking at. So I think we're at risk in the UK of implementing a tech-heavy solution in some of the tenders that are coming out for some of the remote patient monitoring. Part of our role, and we see it as a commitment to patients and to health systems, is that our goal is to gatekeep against too much tech. This isn't a complicated thing that we are looking to achieve. We're looking to collect data from patients, be that soft side data or biometric data, and we're looking to feed that into a clinician so that they can observe it and prioritise their day and their workload as quickly as possible. What we run the risk of is overcomplicating this. The mean age user of our platform globally is 75. Like Healthy.io, the oldest, 105. And we need to obsess around not over-speccing this, or it will not get used. And this is, I think, our personal fear, is that some of the projects that we see being designed at the moment may be doomed for failure long term, because you will not have the level of engagement that we need to build it into operational budgets and to make the ROI appropriate. Internationally, we don't see that cry out for high tech, partly because there's not the money for it internationally, partly because they are acutely aware of the diversity of their populations. But how about the other way round? So, from an NHS perspective, we're lucky enough to go on quite a few trade missions with the UK government, and we go out with a lot of NHS organisations who join these trips with us, and the NHS brand absolutely still stands up really, really well. So anyone looking to do some trips internationally or working in that space, it's a really positive reception that you receive on the ground. Nations are equally really inspired by population level health management across health and care. It's just not a thing in so many nations, and something that they really aspire to. So we were in Johannesburg towards the end of last year, and they are trying really hard to implement and design a national health insurance type, an NHS type model in the country. It probably looking likely like it will be a bit of a struggle for them. But what we know and what we sometimes don't know is that with the UK being so diverse and so regionalised, is that we actually have a great deal of experience in how to manage complex populations, complex societies, and therefore complex health systems. So we're really, really well versed in how to do that. And what that means in turn is that the localisation and personalisation is absolutely key. That plays absolutely globally. And one of the stories that I always tell to partners and health systems that we're talking to overseas is that we can be, I'll take Leicester as an example, we can be working with two hospitals that are 5-10 miles apart, and the clinical pathways that they deliver through Clinitouch are different. And you would never believe that you needed that level of localisation and personalisation. But actually, that's what makes it work. So we've got to try as hard as possible not to deliver a cookie-cutter approach to healthcare, whilst equally not making that too difficult to do. So that's the balance that we always play. But that localisation and personalisation, languages, etc., is absolutely central. Now, how am I doing for time?
3 minutes.
3 minutes. Okay. So I'm going to sum up then. So just to sum up, I've just given you a little bit of a snapshot. It's pretty impossible for us to give you an overview of some of the wild and wonderful projects that we're working on internationally. Please feel free. I'm here for another couple of hours. Please feel free to come and visit myself or Lisa, who's sat over there in the crowd, and we'd be really pleased to talk about some of the work that we're doing. But yeah, thank you for having us. Thank you for listening, and have a great day.